So I'm giving a presentation today on healthy aging, basically on uh, how to stay safe in your own home, just some tips and tricks to do that, and ways to stay active. And I'll share some information on some community supports that are local to Niagara that you might find helpful, or maybe older adults in your circle or in your friends or family might find helpful as well that you could share. So just as a quick agenda here, I'll just go through a little bit about me, and then I'll talk a little bit about, like I mentioned, home safety. And then I'll go over some safe and easy ways to stay active. Again, those types of exercises that we can probably try in our homes. And again, the community supports piece that I'll share as well. So just a little bit about me. I am a health promoter with Niagara Region Public Health. My portfolio and work surrounds healthy aging, which addresses social isolation and social connections. I also address mental health promotion, healthy eating, and physical activity. And on a typical day, I'd be, planning and working on projects, meeting with partners, giving presentations such as this type of presentation, and doing some health promotion on social media channels as well. Okay, so I can move now into the topic of injuries in older adults, and specifically some of the data that I've seen over the years around injuries due to falls. So in Niagara, injuries due to falls are highest among the older adult group. You can see in that figure there that I'm showing that the ages 70 above seem to have a high spike of falls incidences. So it might not come to as a surprise to you that this might happen. This, a lot of age-related changes in the body, our balance and our strength begin to degrade a little bit. But that's why I'm going to go over some supports that you can try in your own home, and also some ways to stay active, which help to increase your strength and balance and mobility as well to help reduce the risk of these falls. So what else the research is telling us is that many falls happen within the home. There is compelling evidence that supports the use of multiple approaches to preventing falls. Like I mentioned, one is exercise. So that's one of the bigger ones to help reduce the risk of falls. Also go over some other things that you could try, like medication review and modification, treatment of contributing health conditions, also assistive devices. So if you have those, it's recommended that you use them, canes or walkers or those types of things. Some environmental modifications, just some things that you can try in your own home to help reduce the risk of falls. And education is another aspect, kind of like attending presentations like this and just kind of learning what other ways you can do to reduce your risk. So I'll go into some home modifications for safety. Some of these might be a bit obvious, and others, you might not have thought of before, but I'll go through them, and they're just tips on things. Again, every little bit helps. So if you are at risk of falls, or you know someone who's at risk of falls, these types of tips could support in reducing those chances of having an injury. So obviously reducing clutter in the home, getting rid of loose wires or cords, as well as any obstacles. Considering using a cordless phone, iPhone or a smartphone. This way the phone is close to you and you don't have to rush to answer it if it rings. Having good lighting throughout the house and installing night lights could be an option as well. And also making sure that any path that you have to walk in your home is clear, especially between the bedroom and the bathroom. Scatter mats are considered tripping hazards. Some people have scatter mats, but if you do have them, make sure that they're non-slip. And it's also important to move slowly out of your bed or chair. Getting up suddenly can make you dizzy. And so again, that's just a tip that you can maybe try to help reduce those risks of falls. In the kitchen, storing kitchen supplies and pots and pans in easy to reach locations could be helpful as well. Storing heavy items in lower cupboards, using a stable step stool with a safety rail for reaching high places, always wiping up any spills immediately to prevent any slipping. If you use floor wax, you could use the non-skid kind. And asking for help with any tasks that you feel you can't do safely. Around the stairs, you could make sure that your stairs are well lit, having solid handrails on both sides of the stairway. Removing your reading glasses when you go up or down the stairs if you have reading glasses. And it's also important not to rush up and down the stairs. It's a major cause of falls, actually. In and around the bathroom, you could ensure that you have non-slip surfaces in the tub or shower. You could install grab bars by the toilet and bath to help you sit and stand or to lower yourself. And obviously making sure that they're well anchored. In the picture there, you can see a couple of them next to the toilet. Using a raised toilet seat and a bath seat in the shower, if you need them, you can use those as well. And obviously wiping up any moisture or spills immediately can help as well. Around the outside of the home, obviously keeping your front steps and walkway in good repair and free of snow or ice and leaves. Keeping the front entrance well lit. And putting gardening implements such as hoses or any rakes or any type of tools away when not using them, so they're not sort of crowding the front area of your home. And again, asking for help with any tasks that you feel that you can't do safely. So those are just a few tips that you could do in and around the home to help reduce your risk of falls. So some other ways to stay safe, like I mentioned, there's a few other things that we recommend here. Medication review and modifications. So what the research shows is that older adults using more than 4 prescription medications daily have been found to have 1.5 to 2 times higher risk of recurrent falls. So if you do have more than 4 prescription medications, you could consider talking to your doctor or pharmacist about the possible side effects of prescription or over-the-counter medications. The idea here is that some side effects of medications interact with one another, and it could cause additional sort of dizziness or drowsiness or those types of things, or maybe putting you off balance, and that in turn can increase your risk of a fall. Reading directions carefully so you're aware of potential reactions with other medications. If your medication causes dizziness or sleepiness, adjust your activities so that you're not at risk of falling. So a good example of that is, maybe taking a rest or doing an activity where you're sitting if you know that your medications have those side effects. And then obviously mixing alcohol with medications probably isn't a good idea either. They could increase your risk of falls. Healthy vision is important as well, having your vision checked on a regular basis. It is recommended that all vision concerns or problems be formally assessed, particularly cataracts. Removing cataracts can reduce your risk of falls up to 30%. So that's kind of an important statistic there. Older adults with chronic or degenerative eye disease, such as age-related macular degeneration and diabetic retinopathy, can be referred to the Canadian National Institute for the Blind for vision rehabilitation services. So what these services basically do is they help you to develop the orientation and mobility skills in the eyes that will allow you to navigate your environment more safely. And lastly, use of safety aids. So I guess in short, if you have them, use them. They can keep you safe and also help you stay active as well. If you wear glasses, ensure that you're wearing them or hearing aids. Considering using a walker or a cane. And if you do use a cane, make sure that it's the correct height and that it's a rubber tipped one for safety. Appropriate footwear is important as well. Comfortable shoes that provide good support can help to prevent falls. And you can ask your doctor or find out other ways and other gadgets that you can use to make your life a bit safer. So for example, reachers. Example of a reacher, I believe it's like a stick with a handle and it has like a claw on the other end, and those types of things can help you sort of just grab something that might be out of reach to reduce maybe a wrenching position or that kind of thing. Anti-skid shoes, hip protectors, and those types of things. So those are some safety tips there that I wanted to share. And again, some of these might have been a bit obvious to you, or things you've heard before or know, but doing what we can to maybe put these things into practice. If you're, at risk of falls, or if you're concerned about that, then they can all that help add up to basically more of a safer environment for you. So I'm going to move now into some staying active tips. So when it comes to exercise, regular exercise like walking or light resistance exercises can improve your flexibility, balance, mobility, and your neuromotor skills. And these in turn, again, can help reduce your risk of falls. A few things to just mention before you were to start exercise. So for example, if you're new to exercise or if you haven't been active in a while, it might be a good idea to talk with your doctor to see if strength and balance exercises are right for you. Stopping the exercise if you feel any pain, shortness of breath, or dizziness. So if you go to start doing some exercises and you feel those types of things, it's probably a good idea to stop the exercise, maybe consult with your doctor and say, I'm considering I wanting to be a bit more active. Here are some exercises I wanted to try, but I've felt this or I felt that. And just, it's good to have those conversations with the doctor. And just a note on shortness of breath. I mean, when you are exercising, you should experience an elevated breath, right? You should be able to breathe a bit faster, but a shortness of breath obviously is a bit different, where it's where you can barely catch your breath. So that's not what you're aiming for there. And again, keeping in mind while exercising, wearing comfortable clothing and supportive footwear is very important. You should do a warm up for about 5 minutes, whether it's marching or walking on the spot. Holding on to the back of a stable chair for support can be very useful, especially if you feel, maybe you're not so comfortable with your balance or that type of thing. A stable chair is good to hold on to so that you could do those exercises safely. And the exercises I'm going to share in a few minutes here, they actually have an example of using a chair for support. So they recommend that as well. Using slow controlled movements, that's very important. You don't have to rush through the movement at all. That could increase your risk of hurting yourself. So using a slow controlled movement is important. And remembering to breathe is very important. Sometimes it might be, an instinct to kind of hold your breath when you do sort of a lift or a press of that type of exercise. But it's actually important to continue to breathe. Typically you would exhale your breath on sort of the heavy action of the exercise. For example, if you were to do a wall push-up, as you push yourself back, that's when you would be pressing out with your breath as well. So you wouldn't want to be holding your breath while you're exercising. Starting slow is important. Try to do an exercise maybe 5 times or 5 repetitions, and then move up to 10 or 15 times if you can. Some examples of great exercises here are Tai Chi, walking, like I mentioned, and swimming and water aerobics are other great exercises. So I'll go into some exercises now that I found have been great exercises that improve flexibility, strength, and mobility. I just wanted to mention walking as one of the best ways to exercise. It's considered a complete exercise. Like I said, it improves flexibility, strength, and mobility. It elevates your heart rate, and over time, if you keep this in practice, it's a great way to stay mobile and to stay healthy. So I always encourage walking. Now, it's difficult sometimes if you use a walker or a cane or a different assisted device, especially in the winter time, if the areas in the built environment around you don't have cleared walkways and that kind of thing. So that can be a challenge. But anytime that you can get out for a walk, I highly encourage that. Other at-home exercises. So I'll go through those now. This slide here, I'll just skip over. I think I basically covered this. Just some tips before you start. Taking time to warm up when you exercise, maybe a cool down toward the end, and then just a word about how you improve. Again, maybe trying an exercise 5 repetitions and trying to move up to 10 or 15 times, and holding the position for a longer duration. And those are types of ways that you can improve as you move into your exercises. Okay, so a few examples of some strength and balance exercises. So if you can see the pictures here depicted in the slide, on the left side, the left picture is sort of the starting position, and the right side is the action that would go into the exercise. So starting with the hamstring curl, you would stand with your feet slightly apart. You slowly bend your knee, bringing your heel toward your buttocks and while standing tall. And then you hold the position for 2 seconds and return to the starting position. And then you just repeat this using the other leg. So it's seemingly quite simple. I mean, it's depending on, there's variability between what someone might be able to do and abilities. So I want to be cognizant of that as well. But this is one exercise here. These exercises are just ones that, using a stable chair for balance and doing some small, simple movements like this over time and done, on a regular basis can help, your strength and balance. So that first one, again, just lifting the leg up, holding the position and lowering it down to the starting position. The second exercise shown there are small squats. So again, you're holding on to that stable chair. You stand with your feet slightly wider than shoulder width apart. You slowly push your buttocks down and back while bending your knees. You hold the position for 2 seconds and then return to the starting position where you're standing. So if you're picturing that while you do it, you're literally just squatting down and standing back up, sort of on a repetitive, maybe you could try 5 to 10 times. So it's not too difficult of an exercise, especially if you're holding on to a stable chair. So that's a couple exercises there that are great. The back leg raise. So again, standing with your feet slightly apart, you slowly raise one leg back, keeping your back straight, and then you hold the leg out for 2 seconds and return it to the starting position. And then you repeat using the other leg. The side leg raise, similar to the back leg raise, you are standing with your feet together in the starting position. You're slowly lifting one leg out to the side. And again, keeping your back straight and tall. You keep your foot pointed forward. You hold the position where your leg is out to the side for 2 seconds, and then you return it to the starting position. And you repeat using the other leg. The toe stand. So this one here, again, holding on to that stable chair. You stand with your feet shoulder width apart. You slowly rise up onto the balls of your feet. You hold for 2 seconds, then slowly lower your heels back to the floor and repeat. The flamingo, this one here is where you stand with your feet slightly apart to begin the exercise. You stand and lift the right knee by sliding the right foot halfway up to your other leg. And then you hold the position for 2 seconds and then return back to the starting position. And then you repeat using the other leg. So the idea there is literally just sliding your other leg up so that it's bent, it's touching your other leg, and then lowering it back down. Walking the line. So this one might seem pretty simple. It can be challenging sometimes to actually do if you're when you're doing it, because the idea here is to place one foot directly in front of the other one so that your feet form a straight line. Oftentimes we don't typically walk like that. We're walking, with our feet next to each other. So putting your arms straight out for a bit of balance is helpful here too. The idea here, maybe do 10 steps and then turn around and repeat the exercise going the other direction. The wall push-up, this is one I mentioned earlier. So this is where you would place your hands on the wall at shoulder height. You keep your heels on the floor and then slowly lower yourself toward the wall by bending your elbows and keeping your back straight. You hold the position leaning into the wall for 2 seconds, and then slowly extend your arms to the returning starting position. And then you hold there for 2 seconds. Keeping your elbows soft, not locked, and then you repeat. So this wall push-up here, this one's good for, bit of strength and upper body strength as well. The last 3 exercises here, hip flex. You lift one leg toward your chest and you hold for 2 seconds. And then you try to lift the leg a little bit higher and hold again. And then slowly return to the starting position. And then you repeat using the other leg. So again, using that stable chair as a support is super important. The step over, this one here is where you stand next to your chair, stepping to one side, envisioning that you're sort of lifting your leg high over a box. And then you return to the starting position by stepping back over that imaginary box so that your feet are now closer together. So it's just stepping out and then stepping back in. And you repeat using the other leg. And again, you can try this 5 to 10 times, maybe 15 times if you're able to do that. And the last one here is sit to stand. So you sit towards the front of the chair with your feet shoulder width apart. You lean slightly forward, stand up slowly using your legs, not your arms, and keep looking forward, and then you stand tall. And then when you go back and return to the sitting position, you lean slightly forward, bend your knees, and slowly lower your buttocks to the chair. So, I mean, this one might sound simple, just sitting up and, getting out of a chair. Using no hands is a bit more challenging. And again, with this one, it really helps with your balance, stabilizing your core. And again, over time, if doing this on a regular basis can help improve your strength, your balance, your mobility, and your neuromotor skills as well. So those are some exercises that I wanted to share. So the last thing I wanted to cover are some community supports in Niagara. What I'd like to do is go right to the supports themselves. So I guess I'll mention them first, and then I'll share the web pages that I'm going to talk about, okay? So resources and support. So the Niagara Region Senior Services, they're a part of the Niagara Region. They have some seniors community programs that you might find interesting and helpful. The Community Support Services of Niagara, they have some programs and services as well that are super helpful. Again, I'll go through some of those as I go through the web pages. One of which that I wanted to highlight that's very important is if you are interested in getting I was talking about the home modifications for fall prevention. They have a service where they can do a free in-home assessment in your home to take a look at where you could benefit from handrails or grab bars in your stairwell or your bathroom or that type of thing. And they can do some installation services there as well in your home to help prevent falls. This one as well, the older adult information link. So this one is super important, and I'm so glad that I heard about this one. So basically, a lot of the times we'll go, to Google to search anything. If you're using, the internet to search things, you type in whatever you want to learn more about. I put some examples here, some transportation or mobility services, health and wellness services, environment, recreation or sports. So we put this into Google and then we get so much information back. We're not really sure who to call or where to go. So this older adult information link is a web page that has every older adult service or program for older adults that are specifically for Niagara. So it basically takes all the guessing out of the work. All of the services are listed there. You literally just type or click on one of the examples of the drop-down menus. And it's super helpful because it just takes some of the guesswork out of. So, if you're interested in using that, awesome. I encourage you to share it wide with anyone that you know who, if they're looking for a support or a program or a service, to check out that link. And if you're not looking or finding what you're looking for, it's also important to call 211. 211 is a service, if you're not familiar with it, you literally just pick up the phone and dial 211. And it's a local service. It's basically a phone line version of that web page that I just talked about. So any program or service, to, for this one's not specifically to older adults, it's for anyone, but any program or service that you're looking to know more about, you can literally just call 211. There'll be an agent on the other end who will do all of that searching for you. They have it all at their fingertips, so you don't have to do a long Google search and try to figure out, write down some numbers and call and that kind of thing. So they'll connect you right to the service. Okay, so this is I'll start with seniors community programs. So that was the first one. That's the first one that I mentioned. So the seniors community programs, this again is Niagara Region. I'm scrolling down to their programs and services, just a couple that I wanted to highlight. The Adult Day Program, helping older adults stay active, cognitively stimulated, and socially connected. So it offers a safe atmosphere where seniors can socialize and engage in meaningful programs. They have some eligibility information there. I won't go through it all, but I just wanted to make sure that you were aware of these. The other one I wanted to share were these two here, the Health and Safe and Strong Exercise Program. Basically, exercise is kind of like the ones that I shared in my presentation. The service aims to improve or maintain strength, prevent age-related muscle loss, build balance to decrease the risk of falls, enhance confidence getting around. So all of those types of great things in that program there. Right now, the program has gone virtual. So I think eventually they'll start meeting in person again. The last one here, the South Niagara Health and Wellness Program. So this one here again is a bit of exercises combined with some health and wellness learning as well. Socialize with others who are motivated to stay healthy, safe, and strong. Learn about some health and wellness, and take part in some of those activities. So those are a few I wanted to highlight there. Again, that's the seniors community programs from Niagara Region. The community support services, this is the one that I mentioned here. In particularly, I'll scroll down to the safety at home. So the Safety at Home program, this is the one here that I mentioned about free home assessments and recommendations to help seniors remain safely in their homes. The service includes installation of grab bars, home repairs, and snow removal to help prevent falls. So snow removal by volunteers, referrals to other services. Yes, Community Support Services of Niagara is a great service, and it's not just the Safety at Home. They also have, looking here, they have transportation services, volunteer visiting, and some wellness support as well. And lastly, let's see, the older adult information link. So this is the older adult information link here. So again, this is that website that has any service or program dedicated for older adults in the Niagara region will be listed here. So you just go to that link here, the agefriendlyniagara.com/older adult info link. Literally, you can click on any of these links here, community safety. So if you click on that and click display all, so any service in Niagara around community safety. So automobile protection, this one here is, that says Carleton Street, Toronto. Bethlehem Housing and Support Services, that's St. Catharines. So health and wellness, if you wanted to display all. And scrolling down, so you have Alcoholics Anonymous, there's the Alzheimer's Society of Niagara Region, Foot Care, recovery homes. Obviously, it's listed in alphabetical order here. Arthritis Society, Diagnostic Imaging, Bayshore Home Health, and the list goes on and on. So there's tons and tons of services here. Bridges Community Healthcare. So it's all different municipalities in Niagara: St. Catharines, Thorold, Welland, Niagara Falls. All of the municipalities in Niagara. Any program or service is listed here, and again, it has the contact information listed as well. So it's a little bit of information about the program and how to get in touch with them. So that's the last thing I wanted to share. I hope this was beneficial for you.